Hi guys, Dr. Gillard here. Let's go through auscultation of the abdomen. Okay, as I said in the lecture portion of this, according to the board books, you don't have to auscultate all the quadrants to listen for bowel sounds. So the first thing we're doing is bowel sound auscultation. So you can pick a quadrant. I like the right lower quadrant, but it doesn't matter. And then you just simply auscultate, and you have to go for 1 minute. So you can't see me, but I got my watch on here, and I'm going for 1 minute. I'm listening for clicks and gurgles, and that's all you can tell. It should be normally between 5 and 35 clicks and gurgles. Okay, so that's auscultation. If you want, Seidel says, if you're worried about it, you can go listen to a minute in each quadrant if you're worried about it. But McGee, Jarvis, everybody says, because you can't tell where bowel sounds are really coming from, there's no sense in going all over the place and auscultating for them. Okay, so if on the midterm, if I say auscultate for bowel sounds, pick a quadrant, plop it down, get your watch out, and go. And then I'm going to say, what are you doing? And you're going to say, I'm listening for clicks and gurgles. I'm going to say, what's normal between 5 and 35. Okay, for the next part on the midterm, I may say I want you to auscultate for bruits. Remember, bruits are turbulent blood flow, probably from atherosclerosis, but it could be from an aneurysm as well. So remember to switch over to the bell tap so the examiner knows that you're really using the bell. And here we go. So you can see the costal margins quite nicely here. These are the costal margins. So that's the xiphoid process would be, I'll tell you exactly where. It's right there. So the first thing you're going to auscultate for is the abdominal aorta. So you will be in just left of the midline, below the xiphoid process. So right about here. And you'll listen for whoosh, whoosh, bruit sounds. They are relatively low in pitch, therefore you use the bell. Okay. Next, we're going to listen to the renal arteries. So you're going to just move out from the midline in that same place you were for the abdominal aorta. You are going to move out until you bump into the costal margin, which is about 3 inches. And you're going to listen here for whooshing. These are bruits. Then you're going to come over on this side. Listen for bruits. Okay, so that's the renal artery. Next, we're going to the common iliac arteries. Find the belly button, and you're going to drop down about a diaphragm or about a bell length, and you're going to go out about 3 inches. That same place where we were listening to the renal artery. That's where you find the common iliac arteries. Another place you might hear a bruit. Listen there, and then listen over here. And then I'm not going to have you do the femoral. I talked about that on the lecture. We're getting down a little too low for this demonstration. The other thing in this area, you can use the bell or the diaphragm, is for something called a venous hum. So you're going to just auscultate. I'll use the bell since I already have it going here. Auscultate around the umbilicus, and you're listening for a continuous humming sound. And it literally sounds like a hum. If you hear it, it's rare, but if you do hear it, it's a very strong indication of portal hypertension, probably from cirrhosis of the liver, maybe from hepatitis, maybe from drinking too much alcohol. And yeah, so that's a venous hum. Okay, and then we're almost done. Now the next thing you want to auscultate for are friction rubs. So now you want to flip back over to the diaphragm, and you're going to go back to the tip of the xiphoid process and slide way out to the midclavicular line, maybe up to 6 inches in some people, but as long as you're in the midclavicular line, and you're going to auscultate right here. It sounds like sandpaper, kind of like rubbing over each other. And you can YouTube that, and there's example auscultatory sounds, which I'm not going to test you on. But anyway, that's where you auscultate for friction rubs. This is usually indicative of peritonitis, probably from liver cancer is the big one you worry about. If you go over to the other side, the big one is pancreatic cancer. So a friction rub, like sandpaper rubbing together, would probably indicate pancreatic cancer or maybe a spleen infarct. All right, and I think that's about it. It's pretty straightforward. And yeah, so we'll see you in the next video.